Good morning, everyone. Good afternoon, good evening, and welcome to the State of the Organization webinar. I'm Jeff Cook. I'm VP of Communications and Development for the Max Foundation. Very excited to be with you here today. State of the Org each year is an event where we try to share our vision for the year, where we're going and how we're planning to help more patients and make an impact in improving healthcare systems around the world in the care of cancer and rare diseases. I'm excited to have with me our CEO, Pat Garcia Gonzalez, and she's going to present, and then we'll have a Q&A. If you'd like to ask a question, you can drop it in the chat. We'll be monitoring and pull them out. I also have the questions that folks submitted in advance. So we'll try to get through all of that. Pat should present for about 20 minutes and we'll have plenty of time for a conversation. So with that, I'll turn it over to our CEO and co-founder, Pat Garcia Gonzalez. Pat?
Thank you, Jeff. Thank you and welcome, everyone. I really want to thank you for attending this webinar. I am aware how busy all of us are, how important your time is, and I really appreciate that you're spending this hour with us. Like Jeff said, I'm Pat Garcia Gonzalez, and today I'm excited to share with you our vision and our plans for 2026. And this presentation has three sections. First, we'll ground ourselves in the mission and the vision and why we do what we do. Then we'll quickly review what we accomplished in 2025, and then I'll go into some detail on our plans for 2026. So as a reminder, to ground ourselves, the Max Foundation exists to accelerate health equity and really to give a voice to those who urgently need our help today. And, we share a commitment, I'm sure, with all of you and a vision of the world where all people can live with dignity and hope with life-threatening diseases. And really, dignity is something I think about a lot because when we get sick, it's one of the first things that we lose. And at the Max Foundation, we really aim to give some dignity to those who are going through a disease journey. And if you have ever heard me speak before, you might have heard that I always tell that from the day we established the organization until literally this morning, every day we receive messages from people from all over the world who are desperately seeking help for their loved ones. And I have to say, there is not much I can say in words that will resonate better than hearing and reading in their own voice. So in the next couple of minutes, I will share a handful of messages that we received in the past couple of weeks to show you a little bit of what I'm talking about. The messages come from everywhere and from everyone. And like in this example and in this message, those in the middle class also fall through the cracks in the most awful way in so many places, because in so many countries of the world, cancer medicines are not reimbursed. There is no insurance that covers cancer medicines, and people have to pay out of pocket. And it's very, very difficult for them to do that. In India, this message is from this person in India. In India, a little bit like in the US, if you have resources, it is possible to access just about any state-of-the-art treatment. However, for most people in India, the out-of-pocket cost is completely unaffordable for everyone. Those in the US must not be surprised with this urgent request that we received even this morning. All of us know that even those insured fall through the cracks in the United States. And I do have to say, if anyone in the audience has any resource that can help this gentleman, I would really appreciate to let us know, because we're looking for ways in which we can help him. Kenya is a country that some people in global health think of as a country that's well beyond other countries in Africa, that has a growing economy, and some movement has been made towards universal health care. But the sad truth is that this 51-year-old lady will not be able to access the urgent treatment she needs. She will not. And the last message I will show you is this one. I really feel her emotion when I read her describing herself as a woman from a marginalized community who writes with deep hope that someone will hear her cry for help. And, you know, today we don't have a way to help her. But today we hear her and we see her. And honestly, for me, I work with renewed determination to visualize a day when someone in her position can have dignity and hope in the form of treatment access. So I really want to thank you for reading these messages with me. It's very important to me that we use the platform we have to share with the world what people are saying, what people need, and the messages that they send to us. Now, on the flip side, our determination is also fueled by watching the results of early intervention. And this is Jessica from El Salvador. 3 years ago, she wrote to us and she sent this beautiful photo of herself. And she was very proud to share the news that she had just graduated from law school. She had been diagnosed with cancer when she was 16. And our programs had allowed her not only to be healthy, but to fulfill her dream of becoming a lawyer. And, since that day when I read the message and I saw her photo, and I think because she was diagnosed more or less at the same age that Max had, and she had the same type of cancer that Max had, that I was very proud and I was very grateful that she was okay. And I always dreamed with a day when I could meet her in person. And my dream came true last October when I visited San Salvador. I found Jessica all grown up with a good job, with a supportive boyfriend. Jessica is healthy and she now continues her treatment, which is provided now by the local healthcare system. So really, Jessica's story reminds us of what is possible, what is possible when we join together towards a better world. And I hope each of you see yourselves reflected in Jessica's smile. And so, thinking about Jessica and so many people like her that we together are able to help. In 2025, we continue to expand our reach and help more patients. So let's go to a recap of what are the main things we accomplished in 2025. I have to say, as many working in international development, in global health, 2025 was a very difficult year. We found ourselves needing to orient ourselves to a rapidly changing world, and trying to figure out what could be the most useful thing we could do. Many of us had to think about a world where all of a sudden, helping for others that are far away seems to not be what the people in power want us to do. And, the fact that they don't want us to talk about it doesn't really mean that the need is not there. Even if we pretend that we don't care or somebody pretends they don't care, the need is still there. And actually, the need for people living with cancer in many parts of the world is larger. It's going to get worse since resources are very, very scarce. And so, for us, we decided to double down and made a bold commitment that we would substantially increase our reach in the next 5 years because the need is there and the patients are waiting for us. On the other hand, the other thing that we did was we spent considerable efforts in understanding and measuring our impact in health systems. We come to global health from the needs of the individual people who need our help today. Yeah. But our human-centered approach does act like a catalyst of system strengthening. And, a good example is our work across many countries to overcome the barriers of diagnosis. Because, once we have the medicines available, the biggest barrier that we have is in having the diagnostic infrastructure. So, the fastest way to strengthen health systems really is first to make the treatment available. And that's what we do. And so we've spent quite a lot of resources deepening our own understanding of our impact on health systems. And then I'm proud to share that we are right on track to achieve the targets we set for ourselves 4 years ago and through our current strategic plan that's called Equity in Action. We have been steadily moving towards achieving those targets. And, you can see for yourselves, I'm not going to read this slide, it's a little bit busy. But all I want to say is that I hope you find yourselves in these results by participating, by supporting those of you on the think tank that have helped us think through some of the biggest challenges, those of you who are ambassadors, and those of you who roll up your sleeves every day and help to solve problems, big and small. We are making a difference together. I always say that the Max Foundation is a network of people helping people. And, I hope that you see yourself in these results. So with that in mind, we landed on 2026 a few weeks ago. It seems already like very, very far away in the past. And we have for this year 4 priorities for ourselves. First of all, we will continue to expand and grow the direct services we give to patients. This is our mandate as an organization, and we will not waver from it. Our second priority, I think, represents the low-hanging fruit, something that we can improve today, which we believe will amplify the unmet need, and we need to more clearly share our learnings with the world. So we will prioritize this in 2026. We will continue our work on unlocking treatment through building diagnostic capacity in low and middle income countries. This is very, very crucial to make sure that more people can access the treatment they need. And last but not least, of course, since 2026 is the last year of our current strategic plan, by the end of the year, we will deliver our next 5-year strategic plan, which really is an operational plan to take us from this bold ambition of scaling our reach to a deliberate plan. So let me give you some examples of what we have in mind for the 4 priorities. If I ever find myself in need of orientation like I did last year, I always go back to the beginning, our true north and our mission to help patients and accelerate health equity. And it is in that inbox that we have help at themaxfoundation.org, where I find the answers. Earlier in the presentations, I gave you a flavor of the messages that come into that inbox, the need that is out there. And as well, I showed you the result of investing in people through Jessica's story. So, we currently facilitate access to medicines for individual patients. We provide diagnostic grants to individual patients. We provide transportation grants to patients, among other types of services. In fact, if I can take a minute, I feel one of the most successful initiatives we launched last year was when we got together and developed a fund to support the tests needed to diagnose children in Nepal. These grants unlocked for these children the opportunity to participate in the WHO St. Jude Childhood Cancer Initiative that provides comprehensive treatment for cancer to children in about 50 low and middle income countries. And yet there were so many parents that did not have the means to pay for the tests they needed so the child could have access to treatment. So this simple act on our part was such an invaluable return on investment, I think, for the children, for their parents, and for all our shared future. So in 2026, we want to pilot 2 new access pathways. One will be to provide copay assistance for people who live in countries where a therapy is available, but cost is the barrier, the kind of messages we saw today. And the second pilot that we want to look into is for patients who need to access a clinical trial where what the drug they need is still in clinical trial, but there isn't a clinical trial site available in their country. So we want to explore, can we give travel assistance for these patients? And by the way, the young woman in this photo is a dear friend of mine from Cambodia. Many years ago, we helped her access a clinical trial in Singapore. She was very sick and she needed a drug. The drug was in development. It was available in Singapore. And for several years, we helped her travel back and forth to participate in the trial. And I have to say that last week, she got engaged. She sent me photos of her engagement. She's doing very well and very happy. And, I think that this would be a really great opportunity for more patients to access a treatment that they need. All right. So as I mentioned before, when I look at opportunities, where are the biggest opportunities for us as an organization? I feel this low-hanging fruit is the focus on sharing what we know after 25 years of operating in these environments. In the course of our work, and typically with the goal of unlocking access to treatment, our team is constantly investing in system readiness assessments. We also deeply understand the real patient journey, the small and big challenges that patients face, and I think more importantly, their investment. As I hope you're aware, free of charge treatment is not free. It's not free for families. Families make huge investments in time and resources. So we, as the Max Foundation, we need to do better in documenting and sharing our learnings. For example, for many reasons that are too long to explain at this moment, people living with cancer in rural communities of the US fall through the cracks of the system. I think we all know that. So we want to start with CML, chronic myeloid leukemia, which is a disease we know so well. It's a disease Max had, and we've had this large program for CML for 25 years. And we want to work with multiple stakeholders and identify the barriers to the optimization of care of these patients so that we can develop a program to help them. So I look forward to sharing more in the future about how this project moves forward. this third priority about building diagnostic capacity, that for the past 3 years, the Max Foundation has spent considerable efforts in helping people diagnosed with advanced breast cancer, not just anywhere, but in the most neglected regions of the world, have access to the treatment they need. Today, I'm very proud to say that we have helped almost just about 1,000 women be able to have dignity and hope in their journey by accessing the treatment that they need. Still, this is just the tip of the iceberg, and what's happening is so many patients that are known to have breast cancer are not able to ever find out which type of breast cancer they have so they can know which treatment they need. And so in 2026, we're working with hospitals in 7 countries to strengthen their laboratory capacity for testing. And I do want to call out our partners at the ABC Global Alliance for Advanced Breast Cancer, the American Society of Clinical Pathology, and all the experts in all the diseases that we work with that are critical to our work and to achieving what we want to achieve. And we look forward to continuing to share progress as we unlock treatment for more patients. Now, this is what I call the checkerboard. This slide. If nothing else, we are ambitious. If nothing else, the Max Foundation, I think you can say we are very ambitious. But jokes aside, we are ambitious because we feel the urgency. And personally, we feel a responsibility as an NGO with this mission. We have the responsibility to work as hard as we can, be as smart as we can, on behalf of the hundreds and thousands of people who are hoping we will help them today. So we don't stop. We don't stop. In 2026, we will continue to advocate for our flagship program, Max Access Solutions. This is the fastest, most successful model to provide access to innovative medicines to patients in countries where these medicines are not locally available. We have demonstrated it, and anyone that wants to make sure their medicines are available should come and talk to us, and we should talk about Max Access Solutions. In parallel to that, there is a need to develop an expansion of our access models and include not just innovative medicines, but high impact, affordable, quality medicines more generally. So we're working on that, and we're engaging with some companies and some stakeholders to achieve this. CML is a very important disease for us. CML, chronic myeloid leukemia, is a type of cancer from which no one should die from nowadays. Yet, still so many of our friends are not able to optimize their treatment. So, 25 years is going to be in May, the 25-year anniversary of the approval of the first targeted therapy, which changed the nature of this disease. Today we have great tools for this disease, yet they are not reaching many patients in the world. So in partnership with patients, with physicians, with industry, we will launch an optimization of care campaign for CML. And because a dream is not a plan, we are deep in strategic planning already, and we will develop our action plan to make sure that the ambition can be reality. So far we have demonstrated that it is possible to eliminate disparities of access and survival from cancer in just about every region of the world. It is possible. So now the big question for us is, what do we need to do? What do we need to prioritize to scale up and instead of helping, let's say, 40,000 people every year, help many, many more, let's say 100,000. So this is what I'm obsessively thinking about. We are engaging with many stakeholders, asking the same question to see what the opportunities they see for the Max Foundation. So I would like to leave you with this thought, and I really welcome your input. And I just want to thank all of you for joining us, and I'll hand it over to Jeff to open the floor for dialogue. Jeff.
Thank you, Pat. Um, Great presentation. Thanks for the overview. So now you have the opportunity, if you have questions, you can drop them in the chat. We had some folks put some things in advance, which is super helpful. So actually, Laura asked the question, I have heard last mile services have especially suffered since last January. I think meeting the changes that happened in global health that Pat had talked about and the US drop in funding. And she's asking, is that happening for us? Pat, I'm happy to take that, or do you want to take it, or how do you want to go?
I can take it. I can take it. The short answer is we don't have federal funds, so we didn't lose funding ourselves. The environment, I was thinking so much these days, these last couple of days. How's the Max Foundation doing? How are patients in the world doing? The Max Foundation is doing well. The patients are not doing well in general because so many of the resources that countries have had to shift towards infectious diseases and other types of needs of patients. So we like I said before, there is more need, and it's just a moment of change. I believe that the hardest part is that it's hard to know where it's all going to end. And I keep thinking about, as leaders, the need to orient yourself towards a new world when you don't know exactly where the new world is going. But so, you saw the messages every day. We receive so many messages. People are having a very hard time. There are no resources for patients to access treatment outside of, let's say, a few programs like ours, and so this is. It hasn't affected the Max Foundation. It has affected patients. I think that's what's happening right now.
We're getting some amazing messages in the chat. One from Ethiopia. Thank you for that. Actually, next question is from Fatima that was written in advance. How does Max envision helping countries and patient communities build towards long-term, locally sustainable access and advocacy? Yeah, I know we have strong views on how that happens. It starts with access to medicines.
Well, yes, but I'd like Fatima to tell me what she thinks we should do. I think, it's this is the moment where we're trying to figure out. Our model is a very successful model, and we have first of all demonstrated that it is possible to help these patients, that the barriers are many, and that you have to remove not just one barrier, but many barriers. So the challenge that we gave to ourselves of, could we have a program that not just helped, 40,000 patients is a lot of patients, but the need is hundreds and thousands of patients. So with what we have, with what we know, what is the type of program we should start working on towards being able to scale up our reach? And so I really put it back to Fatima, and please write to me and tell me what you think about it. And I'd like everybody that's in the line to think together. It's not an easy task, because, as you know, people are there's just a lot of people that need help. So that's a non-answer answer.
So one from Terry Ann, and I'll take this one. How can we best support the foundation's goals? Well, first of all, folks being here, we so much appreciate it. As Pat said, everybody's busy. And there's a bunch of avenues. We always need support. We have Think Tank, which is something that we dreamed up a few years ago to create an outlet because we had so many people approaching us saying, I want to do something, I want to help. And we needed a venue to make that work. So this group of experts that we've gathered that's now grown to almost 120 people from across the world who share our commitment to accelerating health equity and making a difference for people or everywhere is really starting to pay incredible dividends to the organizations. There are projects that some of these outside folks have really played a pivotal role by sharing their knowledge and helping us to make connections. We have a physician survey ongoing that people have helped with. The US program that we talked about, the mapping for, is happening with help from outsiders. So that's a great venue. And of course, adding your voices to the demand for change, I think, is absolutely critical in this environment. And we can't be silent. People need to stand up and say something, which isn't always easy, but it's just we have to drown out the voices who believe that change is unnecessary. I don't know if you have anything to add.
No, I agree with you. I thank you for talking about the unmet need. This is another of my current obsessions, and I'd like to receive feedback on, how do we how do we better share the humanity, the unmet need. You saw today, for the first time, we showed some of the really hard messages we read about every morning. And with care and sensitivity of these messages, we need to make sure that we provide a platform for those people. We have a platform. We have this platform. So if people are writing to me asking for help, how can we share with all of you and with the world their plea and their humanity? And I think that that's something that we're thinking about a lot, because I think those voices are not being heard right now.
I really agree. Next one from came in before. How are you navigating the global health? Oh no, wait. What challenges does the Max Foundation have getting treatment to patients, and how can the logistics community help? I share this question, and Pat laughs because we have a belief system that there are opportunities. There are no challenges. Like, we are continually try to be optimistic and focus on the opportunities. So what are the opportunities we're working on to overcome to help ensure that patients can reach the treatment they need?
Logistics. It is so difficult. The work we do is very, very difficult. We talk about it as if it's very simple, but it isn't. And logistics and supply chains and planning, and it's very complicated. We have really great partners. We have really great people on the ground, but this is an area that we don't have enough expertise in the think tank, if I can say, on logistics and helping us solve issues that come up in logistics. So the best thing you can do, whoever asked this question, is if you're interested in joining our think tank, that would be wonderful. And then we can put our heads together and figure out how to maximize and optimize the logistics of our work.
Next question we had was How do you help access to diagnostics and treatment in LMICs, especially in very limited resource settings? What can these communities do to be eligible for aid and support from the Max Foundation? That was from Christiane.
Yeah. Um, the First of all, we work in about 70 some countries now. 81,
81.
exactly, 81, 81 countries. And our work is very centralized, I do have to say, because cancer treatment is very specific. We need to make sure patients are treated by oncologists. There's few oncologists. Typically, in many countries, there is one cancer center that we work with. Um, and so, we need to make sure patients are treated safely. So we have a whole set of controls to make sure that, we approve hospitals to be our partners. So it really depends in a lot of factors. We have companies that partner with us for access to their drugs. They tell us which countries we can work in, so that's one of the limitations. And then capacity to treat and diagnose is typically another limitation of where our programs are. So because we know so many communities are far away from these cancer centers, what we do is to try to put systems and resources in place to help patients go to the hospital instead of decentralizing the program. So it's a mix between decentralizing in some places, like in Kenya, we've done a good job decentralizing the program. I think in Ethiopia, we're also working to do that, and also partnering with patient organizations and local NGOs to make sure we are reaching those patients and we're making sure patients are reaching the hospital.
I actually see prior to the webinar, Dr. Sukarita put in a question about children with cancer and the role the Max Foundation can play to improve the outcomes of children with cancer globally.
Yes, Dr. Sucharita is a dear, dear friend from Nepal, and she's a pediatric oncologist. I'm very proud to know her and support her work. And like I said, the experience we had last year in Nepal gave us great pride to be able to help some of these children. And so we're working closely with St. Jude and with the WHO to figure out where can we bring that one element that might be missing from their wonderful initiative. Childhood Cancer Day was just 4 days ago. And like I said in the post that I made in LinkedIn, it has to be a priority for all of us who are parents to eliminate the survival disparities, to make sure there is research for childhood cancer. It's one of the most devastating things that can happen to a family. And where I'm personally very committed to doing everything we can to support those that are trying to eliminate these disparities and make sure children have a fair chance.
So, so now actually, Jeff Lane, a great think tank member who's been giving us a lot of support on one of our key projects. Hi, Pat and Jeff. Could you talk a little bit more about the unmet needs that you are seeing? For example, is the greatest unmet need in the diseases that Max is already addressing, or for the diseases that Max doesn't yet have the meds to treat? And he's asking, do we know the proportion of the 100,000 patient goal? Is it going to come from our existing disease portfolio or from new treatments?
Um, the greatest unmet need is the fact that in so many countries, cancer treatment is just coming out of pocket for patients. and is absolutely and completely unaffordable for anyone. And so that's number one. There is no government program, there is no insurance program, and the cost of the treatment is extremely expensive. So this is what we're seeing. If you think about, if I see all the messages that come to us, this is what people, all of them are just like the ones I showed today. And, in parallel to that, obviously, diagnostic capacity is also a huge burden. Somebody was sharing, I think it was our colleague Kathy yesterday, about somebody that has spent $8,000 to get the proper diagnosis, only to find out that they couldn't afford now. They spent all their money in their diagnosis and now they couldn't afford the treatment they needed. So these are really difficult things. So, if we want to help more broadly, we have to bring affordable quality medicines to hospitals in some kind of a sustainable shared resource model. And, quality is a big issue in many countries. So it's not just so easy to think that you can have quality medicines. So I think this is where the solutions are going to come, to make sure that everybody is partnering in a way that everybody contributes in some way, to create some way in which these hospitals are able to provide the medicines to patients. Patients will not be able to solve the problem by themselves. So.
Yeah, it's interesting. It's a great comment, Pat. And one of the interesting things I think we're seeing is that, years ago in these countries, the medicines didn't even get registered. So there was no ability to access. The country wasn't there. We are seeing, and we can think of this as an improvement, but it's not the right improvement yet, is availability is increasing, but that availability doesn't translate into actual access, because between the diagnostic cost and the therapy cost, even if the organization or is offering the drug at, quote, a much lower price point for this population, it's completely unrealistic to the income and reality of the investment that family has to make just to get someone to the cancer center and keep them returning for care, which is an enormous burden on a family with limited income and very high expenses just for travel. So that, it just remains this huge issue that we need to continue to work on strategies that actually focus on the human being and what they can afford and make it sustainable for them. Sustainable to others is not our concern. It's the sustainability for the human being who needs help, and needs that treatment.
Yep.
Then we have a comment from Vivek. Thank you for all your efforts in my country, Nepal. I would just like to ask for your plans to disseminate the services and collaborations with other centers in the peripheral regions of Nepal. Maybe we can begin with the most essential ones and take it from there, or maybe we can develop a collaboration within the country for the ease of patients with your support.
Yeah, I talked a little bit about this before, and for Nepal, for example, a country in which we have 3 centers where we are that we partner with, 3 hospitals, but it's still a big country and there's still many patients that are far away. In order for us to continue to decentralize, we need to partner with the government and the Ministry of Health. And so this is how we have succeeded in further decentralizing. So for our colleagues in Nepal, I know we have wonderful partners in the hospitals that we work with in Nepal. And I think this is the next step, is if we can engage with the government, and the medicines need to flow through the through the health system sort of supply chains if we want them to reach more centers. So we can talk separately and we can figure out how can we start those discussions.
Yeah, we have great examples of that happening. It's part of the process, like Kenya, that's begun in a new way and improved and changed. Um, and yeah, Nelson wants to, we can ask him to raise a question live. I would love that instead of me and Pat just having this conversation. I would love other voices.
Maybe he wants to give us some suggestions. Hi, Nelson.
Hi, how are you, Pat?
Very good.
I became very interested about your comments on logistics. What is the major issue that you see in logistics?
Major issue. The issues are a lot. For example, shelf life is a huge issue that we don't think about. First of all, many countries have regulations about the shelf life of the medicines that can come into the country, and then we run against the suppliers, the companies, and their ability to provide that shelf life. So that's a whole thing. We are seeing the impacts of climate change in the cost of supplying medicines internationally. The extreme temperatures are a big consideration on where and how are we shipping these drugs. And we are finding out for ourselves, we ship a lot of drugs from the US, for example. It is in the US, in North Carolina, that the medicines are going sometimes when there's these cold temperatures, that medicines go, that the packaging goes below the temperature that medicines needs to be, which forces us to have these temperature control packages that are extremely expensive. So I would like to find a group. I am sure we're not the only people that are dealing with this problem of the impact of climate change in logistics of shipping. And so I'd like to find a group that's working on that and maybe join together to figure out how we're trying to solve those problems.
Thank you, Pat.
Thank you, Nelson, for all the work that you do, and you're somebody that really helps us think through the most difficult problems. So I appreciate you very much.
Count on me. Thank you.
So I think we have time for one more question. I don't see any more in the chat. I'm just going to give it a minute. If anybody wants to add a question, and we can even let you be live.
Or make a comment.
Yeah, or a perspective.
Give us a suggestion.
All right, everybody's being shy today. Oh, wait, I think we have a raised hand now.
Oh, Laura. Very good. Laura from Portland, Oregon. Oh, the audiences were trying. She's asking about the audiences.
Policymakers public.
You can
Hi,
take
sorry, can you hear me?
We
Yes,
can.
Laura.
Oh, okay, thank you. Yeah, I was just curious because the strategic plan, everything, it makes so much sense. Thank you also for the response to the last mile question and then hearing about sort of the to decentralize or not balance was really helpful to that. I'm just curious, just as you're laying these plans, and there's so much good work ahead. Like, what are the audiences that you're not reaching yet that you're hoping to reach, or just like reach at a further depth to enable these goals? Like, is it, general public? Is it foreign governments? Is it like the big multinational NGOs like Global Fund or Gavi? Or I'm just curious to hear.
I'll give it to the communications guy.
It's interesting. I mean, we have such a unique mission and do something. I remember when I first was introduced to the Max Foundation as somebody who worked in industry for many years, and often individual patient cases would end up on my desk, very similar to what Pat presented earlier, of an individual who needed access to the treatment that a company I work for, and I would end up having to try to figure out how to do it. I quickly learned that the Max Foundation was the only organization that I knew that was able to do this at scale. And, what we find is even that has taken a while for people to understand that this is indeed possible. So I always feel like one of the first set of messages with almost all audiences is we have to convince them that treating cancer in low resource setting is not only possible, but we can achieve health equity with the tools we have and in collaboration with the capabilities on the ground, which is kind of a core part of our view. We want to strengthen what's there and enable more to happen within the centers in the country, typically starting in the capital city with the largest hospital that has the cancer center for that country. So to me, it's the audiences at the local level, the government engagement and trying to get government to make a priority of cancer treatment and rare diseases is challenging because they're facing many, many other demands and have limited resources. But that's one of the audiences that we're always working on. And actually, we created a new role in the last year or so to focus on those engagements because they're becoming, as our model matures, more important. With the general public, we kind of have we have a unique mission and there's a lot of education to get people engaged. So we tend to focus on other audiences that are more familiar. Many of you who represent those on this call, there's so many of the folks who understand the issues for people around the world in healthcare access. But to me, I think that the key to the audience is what we tried to do today is sharing that significant unmet need and helping people to understand the opportunity to make a difference is there. Pat had mentioned our region head, Kathy Sheepers, and she had raised another story the other day. She's a great storyteller about a patient that didn't have $6 for a bus fare and couldn't reach the center. And that was one of the reasons she didn't get diagnosed. And she passed away from breast cancer because she didn't connect with resources that could help her. Everyone can make a difference here. The money amounts and the investments and the engagement are not big to make a difference for one person. And if we treat it like that, I think we can get more people to step up and make a difference on a person by person basis. And that scales up very, very quickly. So I hope that helps. I know we got a flurry of messages, so I apologize because we're coming close to the end of the time. We appreciate the engagement. So thank you for all of that. We will read through and see if we can come back and respond separately. I wanted to share a couple upcoming events just so you're aware. So this QR code will, if you're not hooked up to our email list and want to find out what's going on a regular basis, you can just take a quick shot of this with your phone and you'll be pulled into the system. We're very active on social media and there's a great newsletter put out by my team that kind of gives you all the updates. Plus we have alerts as exciting things happen. There were so many questions around new treatment options and expanding the medicines we have. I want to assure everybody we are working on that morning, noon, and night. Asking on behalf of all the stories that we shared for more organizations and partners to engage. And despite the challenging perspective in the world, I think this is going to be a very good year on that front. I feel like we're having strong conversations and there's opportunity to do more and to innovate and find new ways to reach patients. So please sign up so you know what's happening. And the next slide is about our Global Impact Celebration, which is going to be held at the Space Needle on April 25th. this is a chance for people to meet, network, see each other, learn more about us, meet our leadership team. Our regional heads will be there. So it's really a diverse group. We'll have some of our physician partners and some patient advocates in attendance. It's a wonderful event to celebrate and talk about where we're going to go next. So we're hoping that you can join us there. And again, I just want to thank everybody for being here and for listening and being so engaged. We're going to work on the format. I want more voices in the next round, so we'll try to get more people to actually have the chance to speak questions live. But thank you all and have a very good rest of the day or evening.